All right, this is a procedural video for a diabetic foot exam. Blake is going to be doing the procedure. Sorry, Blake. And I'm going to be the patient. So basically, general indications for a diabetic foot exam are your patients who have diabetes. The reason you do these foot exams are to check for peripheral neuropathy, signs of ulceration, and any sort of risk the patient experiences that could put them at increased risk for infection. So basically what you're doing is you're screening for ulcerations, infection, or injury, and trying to note if these patients have any pain, numbing, or tingling. Risk factors.
Yeah, so risk factors for this procedure are peripheral neuropathy, any kind of increased pressure on the foot, deformities of the foot or toenails, peripheral vascular disease, previous history of foot ulcers, acute or chronic infection of foot or toenails, and poor foot hygiene.
Okay. The official recommendation is that you do these annually for your patients who are low risk, and then every routine visit for your diabetic patients, so that you're constantly screening and always noting if there is any ulcers present or injury, anything that can put them at increased risk.
So any contraindications for this procedure? There are no contraindications. This is a completely non-invasive screening procedure. You can do it on anybody. All right, guys, so to prep the patient, you want to make sure that they remove their socks and shoes. And a lot of these patients are going to come in with hearing some stories of amputation, infection, dialysis, and other complications that go along with diabetes. So it's important to just kind of reassure them that that's kind of the purpose of this exam, is to avoid any of these complications, catch these signs and symptoms early. So the materials that you're going to need are a monofilament and a 128 hertz tuning fork. Any special considerations with this exam? Take note if the patient has any kind of history of infection, like ulcers, deformities, abscesses, tinea pedis. Just kind of make note of that and refer to podiatry when needed. After the exam, in terms of follow-up care and education, it's very critical that these patients are inspecting their feet daily. It's important that they're washing their feet with warm soap and water. And yeah, we'll stop there. All right, so when it comes to the procedure itself, you're going to start by inspecting. You're just looking at the color of the feet, looking for any calluses, any fissures, any ulcers. Look for any kind of skin thickening, any tears in the skin that can result in infection. You're also going to be looking for any maceration, which is signs of excess sweating, skin breakdown, or fungal infections. Looking at the kind of hair pattern, looking for any lack of hair, which basically means poor perfusion or vascular disease. And you're looking at the toenails, looking for any signs of fungal infection or injury.
All right, whatever you want.
All right, so we're going to start with palpation. So some things that you're going to kind of feel for here are the temperature. All right, you just want to make sure that they're not really cold or really hot. You're also going to start by feeling their pulses as well. And I like to do these kind of at the same time here. Get the dorsalis pedis pulse. And remember, 2+ bilateral is normal. And we'll go to the posterior tib pulse. And you're also going to check cap refill in the toes. And anything kind of less than 3 seconds is going to be adequate. And then while you're doing that, you just kind of are checking for any kind of signs of edema or, again, any discolorations. All right, so testing the vibratory sensation. You're going to hold it right at the end of the toe here. And tell me when you can't feel that anymore. So that's normal. And it's normal when you and the patient stop feeling the vibration at the same time. And let's do the other foot. Can you feel that?
Yep.
All right, let me know when you can't feel it anymore.
Nope.
Perfect. All right, next we're going to use the monofilament here, and I'm going to have him just say yes when he can feel when I press on various parts of his foot. And with this, you just want to press it until the monofilament just barely bends. So we're going to start.
Mm-hmm. Yes. Yep. Yep. Yes.
All right, now let's do the other foot.
Yes. Yes. Yep. Yep. Yep.
And that's it.